All right, Congressman Smith, what are your biggest concerns in your district right now encompassing the Boot Heel and a big swath of southeast Missouri?
You know, John, what I'm hearing from people across southern Missouri is that they just want to get back to work. What everyone wants is to have life normal again. Our country was founded on the ideas of personal choice and liberty. The government cannot and should not manage the risk for the individual. We have to do that for ourselves. Everyone has to decide what is best for themselves. The government should not tell us how to live. All of us are united as Americans by our love of the US Constitution and the Bill of Rights. These are the rules by which all of us live by. They were in place long before any of us, and they'll be around long after any of us. We have to adhere to that and not infringe on anyone's rights. The folks here in South Missouri, like myself and President Trump, know that Americans make their own decisions and don't need the heavy hand of the government to control their lives.
Okay, viewer question right here. Jason from Cape Girardeau writes, healthcare workers are risking their lives in the battle against COVID-19. How do we get them hazard pay? What would that look like anyway, Jason, when you talk about hazard pay? Because we have a lot of people who are putting their lives on the line every day for this.
You know, our healthcare workers are risking a lot. They are warriors. They're the heroes fighting on the front lines. And I want to thank each and every one of them across this state for their tireless work during these difficult times. Back in mid-March, at the beginning of this outbreak, I held a call with all of our healthcare providers, our doctors and first responders, to hear about what resources they need. I've continued to stay in touch with them and offer my assistance. I would tell this gentleman from Cape Girardeau that the way that we go about getting them hazard pay is by having Speaker Pelosi allow the U.S. House of Representatives to meet and allow members to discuss proposals to help their communities, their districts. Unfortunately, Speaker Pelosi is trying to block out our members so she can unilaterally negotiate the next coronavirus response legislation. The needs of rural Missouri are not the same as those desires of San Francisco.
Very quickly, speaking of those diverse needs, I've been speaking with Dr. Ed LaValle, who's an infectious disease physician there in Cape, and he points out that Cape has seen a lot of cases. Outlying areas like Oregon, Howell, some of the other counties in the Boot Heel are pretty much unscathed. Those areas can be overlooked with funding because they're not getting a lot of attention. So what do you do to make sure those areas, even though they're being hurt by not working, that they still get the funding they need to get back to normal?
You have to be the squeaky wheel. We've made it a priority from day one, whenever this pandemic started, of being in contact with our small businesses, our healthcare professionals, our farmers, our veterans, and hearing their individual concerns and relaying those individual concerns back to House and Senate leadership and also President Trump. And a lot of great things have been accomplished from those conference calls that we've been able to get progress from the administration. One is telehealth. It is great that the administration, after our pressing, eliminated the requirement that you have to have visual conduct. You can have audio, but also to have visual to do telehealth was ridiculous in an area like in Southeast Missouri, where we don't even have broadband in some areas. How can you do visual? You don't have cell phone service. So hopefully now with the administration making it where they can just do it by a phone call and seniors can talk to their doctors, get their prescription drugs, that was promising. So when you're looking at 30 counties, you have to look at all different ways in order to fulfill those needs of the folks in Southeast.